Hello everybody, this is Dr. Roy Huson, and I thought I'd just make a quick video to show everyone the case of the month for this month. This was such a lovely chap who came to visit us all the way from the UK, and he complained of broken teeth, and you can see on the x-ray here he had lots of broken teeth that are just deteriorated over the years. He came to see us looking for a permanent solution for these gaps. We took a CBCT scan to measure the bone and measure the positions of where the implants will need to be. And then we placed the implants. We took out the decayed teeth and we placed the implants. We did some bone grafting and we made some temporary teeth for him. He went back to the UK, and a few months later he came back and we placed the implant crowns. And this is what it looked like once the bone had grown around the implants. You can see we placed 5 implants, 2 in the lower jaw and 3 in the upper jaw. And you can see it's integrated really well. The bone has grown really well around the implants, and that's exactly what you need. But what I'm most excited about is how the jaw and face has changed since placing the implants. And on this overlay scan that we've done, it shows from the start of treatment when there were broken roots and decayed teeth, and how the implants have changed the entire jaw and the teeth. And I'm just going to show a little video of the sequences, how we approached this case and the end result, which he was very happy about. So that's the upper jaw, teeth came out, gum healed, implants placed, teeth moved, rescanned, temporaries, and those are the final implant crowns. Lower jaw, we had a similar situation, broken teeth taken out, healed gums, teeth moved into position, implants placed, and final crowns placed into position. It's made a huge difference to this man's life, and he was extremely excited and happy with the end result. Completely full smile, able to talk, laugh, eat, and completely rebuild his confidence.